Students, welcome back. Now we are going to see the glenoid labrum. Here you can see the glenoid labrum. Here the humerus is removed. This is the lateral surface of this scapula, and this structure is the glenoid labrum, which surrounds the glenoid fossa. Okay. So when the arms hang dependently at the side, the two articular surfaces of the glenohumeral joint is having very little contact, that I have explained earlier. That means the majority of the time the inferior surface of the humeral head rests on a small inferior portion of the fossa. So the total available articular range of the glenoid fossa is enhanced, that means increased by the glenoid labrum. Because of this glenoid labrum, which gives further support to the head of the humerus, which rests on the glenoid fossa. This is an accessory structure, surrounds and is attached to the periphery of the glenoid fossa. So because of this presence of this glenoid labrum, it increases the depth of the glenoid fossa or concavity of the fossa approximately by 50%. So that means when we see the depth of this glenoid fossa, it is increased 50% more with the depth of this glenoid fossa. Okay, the core of the labrum is composed of, densely packed fibrous connective tissue covered by a fine superficial mesh consisting of cartilaginous tissue, okay, with fibrocartilage at the attachment of the labrum, to the periphery of the fossa. So over this glenoid labrum, a fine superficial mesh consisting of cartilaginous tissue with fibrocartilage at the attachment of the labrum to the periphery of the fossa. And the composition of this labrum allows to perform a variety of functions, which includes resistance to humeral head translations. So this labrum resists the translatory movements of the humerus over this glenoid fossa, and also protection of the bony edges of the labrum. So it also protects the bony edges, and also it reduces the joint friction. So this glenoid labrum reduces the joint friction, and also the joint contact forces. It also reduces the joint contact forces, and this glenoid labrum serves as attachment site for the glenohumeral ligaments. You can see these are the glenohumeral ligaments and the anterior aspect. So superior glenohumeral, middle and anterior glenohumeral ligaments are attached to the glenoid labrum. And also tendon of long head of biceps, this is the tendon of the long head of biceps, is getting attached to the glenoid labrum. So this is all about the glenoid labrum. So glenoid labrum is having a number of functions in the glenohumeral joint. So the glenoid labrum is the accessory structures that surrounds and is attached to the periphery of the glenoid fossa, which increases the depth or concavity of the fossa by 50%. And this core of labrum is consisting of densely packed fibrous connective tissue, and this one is covered by a superficial mesh-like structure which consists of cartilaginous tissue with fibrocartilage, and it is also having a synovial lining, another important thing, synovial lining, and with the fibrocartilage at the attachment of the labrum to the periphery of the fossa. Okay, and because of this composition, this labrum has a variety of functions which including resistance to the humeral head translations and protection to the bony edges of the labrum, and reduces the joint friction and also the joint contact forces. And this glenoid labrum forms or serves as the site for attachment of many ligaments and tendons. So many ligaments are nothing but glenohumeral ligaments, and also the long head of biceps tendon is getting attached to the glenoid fossa. This is about the attached to the glenoid labrum. This is about the glenoid labrum. In the next session, we are going to see glenohumeral ligaments and also the capsule and ligaments. Thank you.